Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hello, everyone. Welcome back to another episode of HealthiHer. And today we're going to do something, talk about something that's not so medical, but more along the lines of something that a lot of us can relate to as moms. So we have a really interesting guest that's going to talk about being the mom to a child that has a medical issue, but who's also a doctor. So she's been on kind of both sides of the issue. So welcome, Dr. Chandani DeZure. Did I say that correctly?
Chandani DeZure, but yep.
Okay. All right. Well, before we get into the topic, can you just give everybody a little bit about your background and education and what you're doing now as far as your job in medicine?
So I'm a board certified pediatrician who cares for sick newborns in the neonatal intensive care unit. I care for healthy newborns in the well baby nursery. I see children as part of an outpatient clinic. I see sick children that are admitted to the hospital on the acute care floors. And then I also attend high-risk deliveries in which newborns might need resuscitation or help at birth. I did all my training and education in Chicago and then have worked a little bit all over the place, including the East Coast and DC. And now I'm on the West Coast. I actually work part-time in Northern California and part-time in Southern California and live in San Diego with my family.
Yeah. And what is your background as your family? How long have you been a mom?
So I have two boys, almost 2-year-old and a 4-year-old. And then my unicorn husband, as I call him, we've been married 8 years last week.
Oh, happy anniversary. Congratulations.
Thank you.
So, I don't deliver babies anymore. I gave that up about 11 years ago, but and in my specialty is OBGYN. It's a generally happy specialty. Most of the time it's kind of uncomplicated and very, very, very happy. We're not dealing with, in general, sick patients and kind of unanticipated outcomes. And I would imagine in your specialty, you see a little bit of both as well. You see the uncomplicated deliveries, but you're also taking care of a lot of newborns who have some serious medical issues.
Yes. And I think for me personally, I think I span the spectrum of super healthy to super sick. And I guess I would say I'm there for parents on the best day of their life, and I'm there for parents on the worst day of their life.
Yeah. Would you say that most of the patients that you're seeing are expecting a complicated kind of course with their newborn, or is a lot of it unexpected?
It really depends. So I work at a hospital that sees a lot of high-risk mothers. And so by nature, we do see some rarer things or more complicated pregnancies. And those moms are able to meet with neonatologists ahead of time to kind of understand or learn what they might expect after delivery, but we still get plenty of moms that are expecting a healthy baby and it doesn't turn out that way.
Yeah. Which of your child has some medical issues that you've had to navigate? The 2-year-old or the 4-year-old?
The 4-year-old. So my older son, who just turned 4, has a super rare heart condition that makes him medically complex in that he has ongoing specialized medical care for his condition. I think there's lots of different ways to say it. Some people call it special needs, but this is primarily medical. So there can be some overlap, but to try to make it really specific, he requires ongoing specialized medical care.
So was this something that you knew was coming when you were pregnant, or was it diagnosed after birth?
No. So we were my guess, we're not sure, but he probably had this condition since birth. My pregnancy was largely uncomplicated except for him being IUGR. So he was small. But we see a lot of smaller babies, and I'm South Asian, and in general, some of our genetics lend itself to being small. So he wasn't so small. But there was that was something they were keeping an eye on, but he was growing appropriately kind of, at like about the 10th percentile. But he was actually diagnosed around age 2, because he actually at one of his well child checks had a murmur. So his pediatrician sent us to a cardiologist, and they did an ultrasound of his heart, which is when they discovered this condition.
And so how was that for you? I know, I have 3 children of my own, and you certainly always think like, oh, what if something happens? But, I think a lot of people, including myself, think, okay, but it's not going to happen to me. I know it's a possibility, but it's not going to happen to me. So how was it for you and even your husband, of when you were given a diagnosis of a kind of a long-term medical problem for your child?
Yeah, I mean, short version, it was pretty awful, but the complicating factor was he initially had an ultrasound that looked like he had a simple cardiac condition that a lot of people have, that resolves, that yes, you monitor, but it goes away on it. Something along those lines, like it doesn't cause any problems, and you grow out of it. So it was like, okay, well, he has this thing, we'll watch it, we know it'll be fine. And then as we were watching it, it actually turned out to be something else. And I think that's when it really hit us. It was so unexpected, because it wasn't the trajectory we were expecting, knowing he had a heart condition. And it was July 2020. So I was a frontline worker, still working.
Oh,
I was 5 months pregnant with my second. We actually went in to see if like I said, it's a condition that can resolve on its own. So our thought was, hey, maybe it's resolved. We never have to see a cardiologist again. We'll be done with all this and go on our merry way. And it turned out we're going to have to see a cardiologist for the rest of his life. And so it was like being hit by a train, right? Like everything, COVID's happening, we're pregnant, we're expecting good news, but then we get the worst news possible. And I didn't even know how to process it at the time.
So this is obviously, cardiology is not your primary specialty. What did you do as a doctor as far as, I would think most patients go to Dr. Google and try to research as much as possible. Obviously, as a physician, you can take it to a higher level of research. I'm just curious, which I've obviously done, as I've had diagnoses or family members have diagnoses of, you can speak to your family members, doctors at a different level, and do research at a different level. Did you do anything different than, somebody who's not in medicine would do when they have a family member or a child with a medical condition?
I did. And I think that's the piece of just being a physician and a mom that's actually really important to me. So one of my biggest pet peeves is when people say, just be the mom, don't be the pediatrician, or don't be the physician. And it's almost like, well, it's not like my left arm's a mom and the right arm is a pediatrician, and then somewhere along the way I stop using one and the other. But what I actually found is that it makes me the best person to advocate for my son. So absolutely, I went to like medical journals, medical organizations. I have access to resources that and articles that probably the lay person doesn't, and I'm probably better equipped to interpret these articles, including outcomes and treatments and prognosis. Now, he does have a super rare condition, so I can't say I knew intelligently about all these things, but I also was, and everybody has been super supportive, but I was able to get a second opinion quite quickly, and his doctors even facilitated that. Because there is, and my husband is also a physician by training, because we have this underlying medical knowledge of basic, cardiac anatomy, physiology, the level of discussion that was being had with the doctors, with the cardiologists, was also a little higher level and more direct. Like, it wasn't so much information we had to process of just how does the heart even work, right? We already had that piece, and we were able to kind of get to a higher level of discussion sooner, because like I have these discussions in the NICU of like parents just are trying to process the most fundamental of information before you can even get to like, hey, there's more we need to talk about. And it's so much and it's overwhelming. But I felt, and it still was overwhelming, don't get me wrong. But I felt that I hit the ground running a little bit.
How did the doctors take it with you and your husband having that level of knowledge? Did they get annoyed? Were that you were trying to be a cardiologist, or was it, okay, this is so helpful if we can talk at a different level?
I will say, so we are really happy with his team, and we have seen a lot of people. I don't know what they say behind my back. Maybe I'm the annoying parent. Maybe I'm the difficult parent. But I do think it also, they don't have to convince me some of the things they're doing that they might have to other parents. Like the IV, no problem. Like we have to get these meds in him. I will find a way to get these meds in him. I'm not negotiating with them. Like, do we have to do this? Do we have to do X? There's things that I do negotiate. Like, are we sure we have to do X, Y, Z? But it's not everything. So I do think some of that makes their life easier. I also think that I am able to convince them. So I don't like being in the hospital. Like, we do better at home. And if there's things that are borderline, I'm able to, I think, better convey that we will be okay at home, and I'll bring him back if there's the first sign of anything that isn't going well. And I think there's a level of trust that's built in of like, okay, right, she'll be able to kind of tell the difference of when he needs to be brought back in, perhaps more than somebody who isn't medically oriented. So it's a double-edged sword. I think I probably asked some harder questions. I probably asked for more information than some other parents might. But then I also understand a little bit more of what they're trying to do.
Now, did you have any issues navigating the system and getting in for appointments or getting an official diagnosis? Sometimes it's a little harder with the children because they can't tell you what's going on. And as a mom, you're like, wait, this isn't right.
Yeah. So my biggest issue is that this healthcare system is just broken beyond repair, and it's not a physician, it's not a person, that's just how the system we have in the U.S. And so I actually worked at a pretty world-renowned institution, and he happened to get his care and diagnosis there at a center that treats this rare cardiac. So some of this was just lucky. We happened to be in the right place at the right time. So getting in from your specific question of like getting in or getting the diagnosis was actually not too difficult. But the piece that I find so difficult is, so now we have tons of appointments. We see lots of doctors. There's tests, there's imaging, there's procedures, there's different medications, pharmacies, insurance companies. And then, he has an IEP at school because he needs time off to go to do all this. And it's just, none of these things connect to each other. So like, so when we went in for his ultrasound, which, was supposed to be all dandy and happy, they found something that would look, very unusual, strange, and scary. And so it was like, we have to get you into the hospital to diagnose this, like ASAP. But like, it was a Friday afternoon, so we couldn't do it on a Saturday. So we hung around till Monday. And then Monday, he wasn't an emergent case, he was an urgent case. And so he almost got canceled. And you're trying to figure out if your kid is like honestly dying or not, right? Now, a cardiologist tells you something is serious enough, we need to admit you the second we see you. But then there's these logistical challenges of it's not the right date or time. And it turned out okay. I did trust them. But you can see as a parent that this is very unnerving and scary and anxiety provoking of just these things you don't have control over. And then someone's telling you it's not safe to wait, and someone's telling you you're going to have to wait to do some of these things. And that's the piece that I really have an issue with, is that people don't talk to each other. It's such a disconnected system. Something else that happened to us recently. So he actually needed cardiac surgery. And we were rescheduled 3 times for non-clinical reasons. And then the third time it was like everybody
Why
knew,
were you rescheduled? Like the schedule of the
yeah, they scheduled it. There was some protocol, there was some policy stuff. It wasn't clinical reason. Let's put it that way. It wasn't like he got sick and we had to do it, or something happened with his condition that did it. So like the first time he ended up getting COVID, and we could still a little while before his procedure. But the cardiac surgeon and the anesthesiologist disagreed on the best time to do the surgery. So the cardiac surgeon and I were on board with doing it as planned, which was not immediately. It was still down the road. But the anesthesiologist felt that it would be better to wait. But this is a surgery. I mean, right? It's trying to figure out the level of delay that is acceptable. And it's a risk-benefit analysis on everybody's part. But well, we didn't get what we wanted. So then it got to the second time, and the second time was actually a date we picked. And then they're like, we have a sooner date. Can we, and I say this, it got rescheduled, is that we are rearranging our entire lives, right? Like our work lives, our time off, my childcare for my other son. And so each time these things happen, our world gets upended, but we do it because it needs to be done. And then the second time we had the next date was like way later. We couldn't do it. And that felt not okay, but we accepted it because that's all we had. And then they were like, oh, we can fit you in sooner. So then I was like, awesome, great. We had a cancellation. So then we rescheduled for the third time that was slightly sooner. And then we actually had to fly to another institution actually we moved. So we flew back to his home institution with him in tow. We did his pre-op. And the morning of his at clinic, his pre-op, I had asked, are we good to go tomorrow? We've been rescheduled 3 times, we need this to happen. And they're like, yeah, everything's good. Everything looks good. The surgeons knew, the nurses knew, the whole team knew that we had been rescheduled multiple times. This was not an elective surgery. It was urgent. It was when we were coming in from out of town. And everybody was on board except the person that gave away his bed at 3 a.m. the morning of the procedure. And so there was no bed available.
Oh, jeez.
I mean, just these things add up, right? And you're just like, as a doctor, you get it, right? You don't have control. You don't have control over the bed situation. Right? Like,
No,
you don't. And so
they're like, there's no beds. Yeah, you can't admit your patient.
So I understand that from a physician perspective, but I don't from a mom perspective, right? Because my kid needs surgery. So then this is the piece where I can do, because I'm a physician and I'm well connected and I have resources and I know that's very privileged, but it's my kid and I will do whatever it takes. I actually transferred his care for his surgery out of the institution that had known him for 2 years, that knew him in and out, to a place that had never seen him before. And I just said, I need this surgery. Can you do it? And I was able to actually email the surgeon because I have a friend that worked there, and she gave me his email, and then we were able to facilitate it quite quickly and get it done. And it went really well. But it's not the situation I would have thought as ideal for us,
Yeah, that sounds uber frustrating. You mentioned that the healthcare system is broken. And if anybody's ever listened to any of our podcasts, most doctors that we talk about on the podcast, we talk about myths that have been out there, how our training as a lot of OBGYNs is insufficient, what's covered by insurance. I mean, if you listen to all the podcasts, you'll hear so much frustration in medicine, or the patients we've had on just express their frustration. So what is your perspective other than canceled surgeries, which sounds maddening? Also as 2 physicians navigating your schedule. And were you pregnant during all of this as well?
Yeah. I was pregnant initially. At the time of the surgery, no, my son was like 1 year, about a year old at the time of the surgery. Yeah. My other son was about a year old. So
yeah, I know we don't have 4 hours to talk about how the system is broken, but just since you mentioned that, I'd love your perspective.
So if I had to pick a piece that I find most frustrating, I think it comes down to miscommunication, because there's a lack of accurate information that's shared because the system is so disjointed. Like you said, there's errors, there's delays, there's insurance drama, there's the prior auths, there's the cost of medications, and you know this, I know this, right? I ask the same questions that the parents been asked 15 times, but there's being asked the same thing over and over and over, and yet still not getting a result that accommodates that is frustrating. And I feel it comes down to a fundamental lack of understanding of a patient's personal situation, but also the inability to easily get to that understanding. Like the cardiologist didn't know everything else that was happening. There's no easy way for them to know it. And I think that's the piece that gets lost. And one of the other things that for my son, to just give an example, it's a small thing, but it's a kind of a big thing, is that he is impossible to get medications into. I'm a pediatrician who counsels parents on how to get meds into their children. And I have tried every trick in the book. So it is incredibly difficult to get my son to take medications. And he's on a bunch and we get it in him. But then when more medications get added, they're just kind of like thrown at him. And I'm like, no, we're going to have to prioritize what has to happen and what can't. Like, we're just going to have to live with some side effects because I will not be able to get this medication in. And worse, he'll probably throw it up, which means he'll lose the actual medication he needs. So it's like, but we have to have this conversation every time. Like, what do you mean you can't get meds in your, have you tried this? It's like a 20-minute conversation. I'm like, trust me, I know what I'm saying about this medication. I get it. I get you recommend it, but we're just going to have to do the best we can instead. We're not going to get perfection here. But it's that kind of like, like the appointments get rescheduled and canceled. And thankfully I have a portal that helps me stay more organized. But just like, making an appointment, it's like they call you. If you don't pick up, then you call back and leave a message. You can't even, and then they call you back again. You play this phone tag. It's just these little things that's like death by 1,000 cuts. There's no one egregious thing, but it's exhausting and it's a full-time job to just do the medical piece of this.
Yeah. And you and your husband you're working full time? Yeah. We won't even go into, like, as physicians, we do have a little bit of an advantage when we do have to navigate the healthcare system. But how did you guys do that working full time?
Yeah, so I mean, I think so. My work was actually pretty understanding when everything happened, and strangely, I was pregnant, so I went on maternity leave shortly after. So a lot of this happened on maternity leave, and so it's not a vacation, right? But it's time that I wasn't actively working, that I was able to find emails and talk to friends and friends who are cardiologists and find connections. We had connections to get to the right people. Some of it was luck, and I'm part of a big physician moms group that, can easily connect you to other people in the field. And that's how we did it. It was just like we cold called or cold emailed people, and people are honestly, other docs are also like more open to, they're willing to help other docs too. So at least that's the vibe I got, is that nobody was like, oh my God, I can't believe she just emailed us.
And I don't know, do you have a clinic schedule, or does your husband have a clinic schedule? If you guys are probably canceling patients at the last minute.
We are, yes. And so, and at first, so I think we can talk a little bit later now, or just like how we manage our own stress. And I used to feel super guilty about, canceling last minute and like, oh, my patients will be so upset. Mm-hmm. Or I have to, even when I'm in the NICU, I work shift work, and it's like, oh, I have another time my colleagues I'm going to have to ask for coverage for another time. And people are helpful, but we're all burnt out. We're all morally injured. And it's to a point where it's like, oh, another email for coverage. And I have found myself just feeling less guilty about it. I'm doing what I need to do to take care of me and my family, and I'm not going to feel guilty about it. And that's, I think, the piece that has gotten me to a point that's manageable.
Yeah. As physicians, at least prior to COVID, like, you would go to work sick. Like, you would go to work when you didn't feel good. Like, calling off work as a physician for whatever reason is like, we just don't do it.
It's funny because once I started, I had never asked for coverage or support that in that way before. Because yes, you just sucked it up and you went to work. And I remember in my 8 years practicing before my son was diagnosed, I think I had 4 days where I didn't called in sick or didn't work for like a funeral, I think a couple sick days, and then like some other personal thing. So 4 days in 7 or 8 years, right, I had taken off. And then since he was diagnosed, I've just asked for so much coverage. I can't even, I pay it back, right? It's not that I'm just getting time off, but I just think of like, it's just a different situation we're in, and I'm okay with it.
Yeah. Can you touch on how you and your husband coped with, that's a lot of stress, working full time as a physician, being pregnant, and having a child with a medical issue. How do you keep it all together?
Wine. No, just kidding. Sometimes.
That helps.
That helps. But in general, like I said, it took a little time to get there, but I'm slowly getting to it. And I think I'm finding a support system that agrees or is in alignment with how I think. And it's a little bit of finding time, which is easier said than done, to, I guess, like Marie Kondo my life. Like, does this give me joy in terms of like a work perspective? So I'm able to like say no to things and then say yes to the things I need or that I want. So the little thing, just from like a personal perspective, I get my nails done. Like once I got vaccinated, watching a movie. I'm a huge fan of lump day, which I used to think was like this lazy thing to do, but lump day is like my day. I sit on the couch like a lump and do absolutely nothing. Read a book, watch TV. I don't care. I turn my brain off, but
I like that. I've never heard that term, lump day.
And people used to say, oh my, like I used to think like doing nothing, that's a bad thing. Like, no, it's not. It's an active, like it's actually an active attempt to do nothing. In a world where we're constantly doing something, I have found a couple of fun podcasts to read.
Yeah, what do you do with your kids on lump day?
Oh, they go to school. I send them to school. Okay. Yeah. I mean, and I don't feel guilty about it. Like, oh, I'm at home, I should keep them home. Nope, go to school, daycare, bye. We spend plenty of time together as a family as well. But I have found that sometimes I need a me day. I have, like I said, I found a couple of podcasts that I like listening to for fun. I've restarted getting into books for fun. And then when my kids are little, so when they go to bed, like my husband and I just sit on the couch and watch like either cuddle or talk or find time to kind of keep our marriage going. We don't like, occasionally we'll do some work, but typically we don't. And then I found a cheap massage place nearby that I use too.
How do you not get angry with the broken healthcare system and why is this happening to me? And how do you guys not just be angry at everybody you come in contact with?
Yeah, and I think there are times where I am angry, I'm frustrated. And I think what I have found, and the surgery thing was a big piece, big time that didn't go well. But in general, I have found that it's consuming and not productive. And so I don't ignore it. I think it's just, I accept that there is a room for anger, there is room for frustration, room for sadness amongst all of this, but that it can't take up all our energy, that it has to be a small thing in our world of overall joy. Again, easier said than done. But it's more of, sorry, my husband just peeked in. Okay. I'm sorry. I think it's more compartmentalizing it or putting in a place where it's not the prominent feature of our life.
Yeah. You know, nowadays being a physician, I think in every aspect of medicine is real. It's always been stressful, but after COVID, like things have really changed. I don't know if you've noticed it in your practice, but I feel like sometimes people are just more demanding, angrier. It's just been harder. Also, like staff shortages. I don't know if you have that where you work. It's not as easy being a physician in 2022 as it was in 2019. Would you agree to that in California?
Yep. And we even had a nursing strike that in the middle of it. So it's been stressful, but I think everybody is stressed, right? I think it's the physicians are, the patients are, and I do feel that some patients have this like more entitled need sometimes. But I've also found people others to be much more understanding of when I need to change my schedule because they need to change their schedule too, right? Just my kids' school closed because there was a COVID exposure and I just had to, not show up to work, cancel some clinics. And like people were upset, but then people were like, wait, that happens to me too. Like next week, my kid's going to come home from school and not be able to go. So I'd say it's both sides. I've seen a lot of entitlement of I need this right now but also like you guys have been through a lot, and I get it too.
Yeah. On the flip side, there are some perks, like you were able to email doctors and text people and Facebook message. And so for somebody that doesn't have those connections, what would be your advice to a mom that is just faced with a kind of a serious diagnosis for a child? Like, other than that initial grief and possibly anger of, okay, when you're like ready to get to business, like, okay, what do you do? How do you navigate this complex system?
Right. So I think the biggest piece of advice I can give is you just have to, you have to get your shit together. You have to get your stuff together. You have to be organized, and because nobody is going to be able to do this for you, because people just aren't talking to each other. So for somebody who's going to have a complex condition over a longer period of time, I say get a binder and start filling it with all the information you have. And then just keep that with you so that if you ever have to refer, so you have all this information that you may have to refer to, that's including labs, tests, any visit, even your pediatrician visits, your shot record, like all these things just need to be in one place. And I say, honestly, see if you can get your medical records every 6 months if you're getting medical care frequently, so that all of that is updated. So you just have that. Then I say the organization needs to come to like appointments and visits. And so who do I need to see? When do I need to see them? What's the in prioritizing, what's the urgency of seeing them? And then I think the biggest piece is when you get to clinic or hospital, or you talk to the doctors or the nurses, have questions ready for them. So whatever your concerns are, whatever your questions are, prioritize them, but have them ready so that you're able, even if the visit is shortened for some reason, or you go off on a tangent, you get your most important things answered, because then that'll give you some comfort with the anxiety that you're feeling or the stress. Those things are probably the most stressful. Of number 1, 2, 3, whatever those are, get those resolved. And then always leave with a number in your hand. Like, who do I call if I have a question about medications? Who do I call if I have a question about his clinical status? Who do I call, and how do I get a hold of them? What if it's after hours? What if it's overnight? What if I run out of medications? Who do I call? And I think all those things need to be in place. And I'm on a Facebook group of non-medical people, and moms frequently are scared. Moms or parents are frequently frightened to ask for a second opinion. Most doctors are open and even willing to facilitate it. And I feel most of us are willing to acknowledge that we don't know everything. And it's just getting off this fear of just, I'm not sure if I should ask this or not. Ask it, and what's the worst that could happen? They say no. And so if you don't have these back alleys, backwards, back doors to other physicians like I do, or institutions, your physician team should be able to help you. And if not, your pediatrician will. Some of the big children's hospitals also on their website just have a tab that says, if you want a second opinion, click here. Mm-hmm. And so you can even, if you feel like your team isn't supportive, you can even bypass that. Now, it is expensive to do it your own route, but it's doable. And so wherever you live, find out find out the big names in your area. Like, who are the cardiologists and who are the institutions that have this type of care, cardiology, GI, OB-GYN, and then what are their contact? Everything's available online now. Some sort of contact information is, even if it's not their direct email. And they're usually pretty responsive, but it'll take longer than it took me.
Yeah. I think your point about a second opinion is really good. I think if you're a upstanding doctor, you're never going to be offended when somebody tells you, this sounds great, but I'm just going to get another opinion. Perfect. Like, that's never going to hurt my feelings. There's plenty of patience for doctors. What about doing research? Obviously you did a lot of research, and most parents are like, okay, I'm going to do my own research. But how does somebody that's not in the medical field, or what would you advise of, how do you find out more information so you know what they're talking about when you don't have a medical degree?
Yeah, so I would actually say, for especially complex diseases, not simple things, stay off of Google. Google is not your friend. You can ask your team for specific resources that are relevant to you or your child. But the other thing that I find more helpful is that there are associations for almost every disease out there. These are like professional organizations that are that'll have very factual information and helpful information. So it typically includes resources for clinicians, it includes resources for parents. And then through those resources, I think you can find not only more information, there's usually support groups of other people going through this, what you are, and there's ways to connect you to that. There's plenty of people that do like monthly support groups, like over the phone or over social media. There's all these associations out there. So there, there's there's, a cystic fibrosis foundation. Like all these foundations have resources that have been much more vetted than Google.
Yeah.
And they are targeted to patients. And so I would go down those routes. You can always search for journal articles, which is what we typically do, but it's not, unless you have a medical background, it's really hard to interpret those and understand what it's saying. So I would actually stay away from those as well. But we have so much information on a lot of diseases right now that you can find support, and everybody's on social media. So cystic fibrosis, my son doesn't have cystic fibrosis, but that foundation is on Twitter and it's on Facebook and it's on Instagram. I mean, I'm sure it's on all these platforms, LinkedIn, right? So that you can find a way to direct message or connect with somebody to get you to a point where you can get what you need.
Yeah, that's great advice. I have one more question and then I'll let you go because I'm sure you're busy. Like somebody that was a stay-at-home mom with a 2 and 4-year-old. I called those the blurry years of my kids are all in high school and one just graduated. And I look back on that. I'm like, sometimes I have a hard time remembering. Like it was just so blurry. Like, I was always tired. Somebody was always crying or up all night. Like those are hard years.
Well, it's funny. We get screened at the hospital when we go in for COVID symptoms. And it's like, do you have fatigue? I was like, yes, I have children. I always have fatigue.
Yes. So last question. How has this changed you as far as being a physician?
Oh, it is. I wouldn't wish upon anybody to have a child with a chronic disease or a medical condition or a special needs child. And I keep using these words here, but I think this goes for any caregiver who's taking care of somebody else in the medical system. So it could be a child, it could be a sibling, it could be a parent. I mean, elder care is even harder because you're not the primary person they contact typically. So I mean this is like the medical system is hard for everybody who has to be involved with it. And I think it's made me such a better physician. I'm in the neonatal ICU for a lot of my time. And I used to think I understood patients. Like, I get it. I get what they're saying. I understand them. But I didn't until I had to be on the other side of it of like, this is so much harder than I ever realized for the family, for the parents. And so now I'm much better at identifying what cracks need to be filled specifically for each family. And I'm much better equipped to fix them. I'm way more, I always thought I wasn't judgmental, but I'm even less judgmental. Like, we say, like parents who can't come in, they're like, oh, parents, our NICU babies are there for a long time. And it's always like, oh, did the parents come in today? And it's like, oh, they're not coming in. But you know what? They have other kids. They have jobs. They live 4 hours away. These are all reasons. It's not like they don't love their kid. It's that there are these obstacles in their way of being there. And there's not a lot of paid family leave. So if your child is in the hospital for 4 months, you don't get to always get that time off. So I just think not only can I recognize it better, I can try to get those resources better because I'm not sure those families know what they have available too. Like we have gas cards to get you physically here. We can arrange, like our social worker helps arrange transportation. And again, we try this, but until you've been on the other side of it, you don't realize like all the different logistical pieces that have to work for you to be able to access the medical system.
Yeah, that is great advice. I'm sure a lot of people listening to this have found this so helpful, as well as just kind of refreshing that it's not the end of the world. There's still a lot of joy to be had despite the frustrations and setbacks.
correct. We're a very happy family. There is room for sorrow and sadness and anger, but again, we try to compartmentalize that and realize we try to see the big picture, right? Where does this land in the big picture? And carrying this with us is not an important part of that. What's more important is the time we spend together.
Well, thank you so much for being so open and sharing your story. We all really appreciate it.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.